I'd like to just thank everybody for taking the trouble to come here tonight to hear Ray Ferguson. So to introduce Ray, he's probably known to you from Monash Veterinary Clinic, but he graduated from the University of Sydney in 1972. A bit of humour here, he voted for Gough Whitlam in that year under the instructions of his current girlfriend and ended his conscription obligations. So he wanted to make sure he wasn't taking full responsibility for that. He spent 3 years in mixed practice at Numurkah and only missed 2 games of football in the 3 seasons with the Numurkah Navy Blues. So obviously the sport runs, not just the sporting dogs, but the sporting vet. He then spent 18 months in mixed practice in Cranbourne in Victoria. For the past 40 years, Ray has practiced at the Monash Veterinary Clinic in Melbourne. He has a special interest in reproduction, canine sports medicine and surgery, canine orthopaedics, hip and elbow dysplasia, lameness examinations, and stem cell therapy for the treatment of arthritis in canines. Ray's an active member of the Australian Veterinary Association and has been on the executive of the Australian Greyhound Working and Sporting Dog Veterinarians since its inception in 1985. He has published several scientific journal and conference articles on greyhound and sporting dog surgery and medicine, and canine reproduction and breeding. Ray's a lecturer at the University of Melbourne for final year students on canine sports medicine, and a long-suffering Collingwood supporter, and has a passion for fly fishing, so if you want to talk about football, you know which team to discuss. Thank you very much, Ray.
Thank you, Wendy. Okay, we're good to go. Welcome, everyone. So we won't talk about Collingwood, or we won't talk about the Rebels, the Wallabies either. It's not a good year, or the Storm. Okay, so we're going to talk about the ageing dog, and I thought about this, and I thought, what are the problems we see with old dogs? And I thought it's just the same as old people, and it's pretty simple. They go silly, and they become incontinent, and they get stiff, and that just about sums it up. So if you think about your old dogs, that's once they've got through whatever heart disease or kidney disease, these type of things that can happen to any age of dogs. For the older dogs, this is the 3 things that we've got to deal with. So we'll talk about Dogsimers or senility or canine cognitive dysfunction, as the behaviourists like to call it. First of all, we'll talk about going silly. The symptoms. What do the old dears do? They park themselves in a corner. They may lose bladder or bowel control. They have behavioural change. They may bark at night. Their diet may change. Their eating habits. And often they'll become anxious, and this tends to occur more in the evening as we get softer light going on. And they'll start to puff and pant and just seem a little confused. They may forget their tricks, and they're just about impossible to teach new tricks to. That's it. That's what we've got to deal with. How do we treat it? Look, I haven't got a lot of good news. We can try fish oil, the omega-3 fat DHA, that will sometimes help brain function. I think when they're getting confused at twilight, keep a light on at night, and that's also particularly important for dogs that get vestibular disease. For those of you that had it when the dog's head goes on the side and they become a little bit incoordinated. It eventually self-corrects, but we need a light on at night for them. And for the dogs that won't sleep, I love a little bit of Valium at night. Valium's a wonderful drug. It washes out very, very quickly. For those of you that have ever had it, it's great for back pain and great to have a good night's sleep. But you wake up in the morning with no hangover, as it were, as distinct. So to give a dog that's restless and disturbing your sleep a little bit of Valium at night is a very useful thing to do. We can try to teach them new tricks, try to introduce new exercises into their daily routine, but it's difficult. There's also a drug that the behaviouralists like to use, selegiline. I've tried it a couple of times. I'm not so sure. And I think the most important thing we can have is just understand that these old dears are getting old and we've got to work with them. That's senility. We'll talk about fecal incontinence. I'll talk about fecal incontinence before urinary incontinence because the most common cause of fecal incontinence is related to degeneration of the lumbar spine and the lumbar nerves. And when that happens, the dogs become fecally incontinent before they become urinary incontinent. So the most common cause is degeneration of the nerves. Just Alzheimer's, when they just lose track of where they are or what they're doing is certainly a cause. And anxiety too can make them become a little bit incontinent, both fecally incontinent and urinary incontinent. If there's a change of pattern in the house and they're getting a little older and more confused, then they can become fecally incontinent as a sequel to that. And we've got to try to work out what's gone wrong in their lives. Treating it, we've got to treat the spinal problems if they're there, and I'll talk about that later on in the talk. Sometimes low residue diets, just feeding, avoiding high fibre diets can help. If we think there's a stress factor involved, we've got to nut out where the stress is. And for some dogs, I think the only answer is a warm kennel, and we've got to put them outside rather than having the carpet wrecked every day. It's a real problem. Then urinary incontinence, multitude of causes. The most common is a urinary tract infection. And if your dog, particularly a bitch, has got a urinary tract infection, believe me, you can smell it. You know, there's that musty old smell of dogs. And if you can smell that, there's invariably a urinary tract infection, a cystitis, and they need some antibiotics. We can see urinary incontinence in our spayed bitches when they are lacking in oestrogen because we've spayed them. The oestrogen actually helps strengthen the muscles and the collagen, the connective tissue in the bladder and the neck of the bladder. And there's probably a number of you here, you've got your old dears on still Bestrol. Propylene is the more commonly used drug, and that just tightens the neck of the bladder, and it works very, very well too. And dogs that are incontinent then have a predisposition to urinary tract infections. Okay. We can have incontinence because of overflow problems. A dog that's got sugar diabetes or chronic renal disease where they're just making a lot of urine, and so there's always a full bladder, that can lead to incontinence. And things like bladder stones and tumours will also cause dogs to be incontinent. Other causes is degeneration of the lumbar spine, Alzheimer's, prostate disease in boys. For those of you that have got entire boys that are becoming old and they finish their breeding, I think the best thing you can do is whip their gonads out. Male dogs don't get prostate cancer anywhere near to the same extent as us poor blokes do, but all male entire dogs, as time goes on, under the influence of testosterone, the male hormone, the prostate will enlarge and enlarge and enlarge, and this will cause, or as a sequel of that, they'll get infections, and you can see dogs affected with prostate disease. They'll stand there and there'll be a little drip of blood coming out their sheath. And the simplest thing to do is just castrate them, and it cures very, very quickly. It's a great trick. We can take a prostate that's about that big, castrate them, and when you see them to take the stitches out a couple of weeks after, it's back down to a tiny little almond size. And as with fecal incontinence, stress and anxiety can be a factor. All right. So that's the silliness and the incontinence done. Let's get on with the stiffness. Arthritis. Primary arthritis occurs in us, occurs in people much more than dogs. Primary arthritis is wear and tear arthritis, and dogs really don't have a lot of wear and tear arthritis. But they have secondary arthritis. They have arthritis that's occurred because something's happened. An injury can be a main component. So if we've had a car accident, as this dog did, it's broken its hock, that's got to be plated back. There's a bit of bone chipped off here. Similarly with this wrist, where we've got chips of bone in it. No matter how well we put those joints back together again surgically, or whether we put them in a cast and let them heal, there will always be some residual arthritis in those joints. Obesity is a really important factor in arthritis in dogs, and it's one of my main weapons in treating arthritis, is to get weight off dogs. And it can be very difficult in older dogs to get weight off because they can't exercise much because they're stiff. They can't go out and walk for 1 or 2 hours to get the weight off, and it becomes a snowballing thing for them. And we now know that the fat tissue or the adipose tissue can secrete products which exacerbate joint disease, which actually promotes the degeneration of joint cartilage. And that it's a bit counterintuitive that this should have developed this way. You think, that you if you've got a large amount of adipose tissue, then that's going to exacerbate your arthritis. And I don't quite understand genetically or evolutionarily why that should have happened, but that's what happens. And if we look at a galloping map of a dog, we can see that during a gallop, at some stage, one leg is on the ground. So if we look at this dog galloping and we've got weight on the left front, move forward, weight comes on right front, in the air, land on the right hind, push off with the left hind's the only leg on the ground, in the air again, and land on that left front. So during that gallop, all the weight is on, at some stage, all the weight is on one leg. So the lower the weight of a dog suffering from arthritis, and the same with us, the less stress it's got. Inactivity is an important contribution to arthritis, because a sedentary lifestyle leads to weight gain. That's quite intuitive. And inactive dogs don't build up muscle strength around the joints, and we need activity to maintain strong muscles and maintain strong ligaments and tendons around the joint. And so any impact exercise is really, really good to keep the muscles and tendons strong, and also to exercise the joint cartilage. Now, joint cartilage doesn't have any blood supply. So to get nutrition into the joint cartilage, we've got to have weight bearing. So if we look at this model here, there's bone, there's what we call the subchondral plate, and this is the joint cartilage, and there's the joint there. And so during a weight bearing load, the joint cartilage is squashed down, just like a sponge. And then when you take the weight off, it sucks all the goodies back out of the joint fluid, and that's how joint cartilage receives its nutrients. So to be inactive you just get worsening stiffness. Arthritis and genetics. Now, long back dogs, Daxies, Bassets, these type of dogs are very, very prone to disc degeneration, to the development of spondylosis along the spine. Lots of other dogs are affected with back problems too. In fact, most old dogs have got some back degeneration, and in any lameness workup that I'm doing in older dogs, I'll always take radiographs of the back, particularly of the lumbar spine, and I'll say to the young vets that I work with them, I'll say, Ray, can you come and have a look at these x-rays? And they might have, if they think the knee's the problem, they've got x-rays of the knee, but I say, where's your back x-ray? You've got to check everything. And that's because all breeds are prone to develop this spondylosis. And many breeds are affected by hip and elbow dysplasia. We can get inflammation in joints. We can see infective arthritis in young puppies where they've got a little bit of infection through the umbilical cord or sometimes through a septicemia, and they're really difficult to treat, and those puppies will often end up, even though we've got the arthritis under control with the antibiotics, they'll still end up with some secondary arthritis because of this infection. And we can see arthritis develop after a penetration wound or after a fight with another dog or a cat. And similarly, we can see it rarely with autoimmune conditions, rheumatoid arthritis and pemphigus. They're very, very rare, joyously, in dogs. So let's talk about shoulder OCD. Now, shoulder OCD occurs in many large breeds of dogs. So you see a front leg lameness, and we see on x-ray we see a lovely normal joint line here, and then there's an ulcer here where the cartilage has degenerated away. I don't think there's any specific genetic basis to it. No one ever has a shoulder OCD problem, but occasionally you'll see it in lines of dogs. There was a few years ago we saw it in a line of greyhounds, we saw it in some boxers, but it doesn't ever become a persistent problem that we've got to think about doing something as our clubs or what have you. And joyously, shoulder OCD responds very, very well to surgery. It's a fairly straightforward piece of surgery, and some dogs will actually recover if you do nothing, if we just treat them with rest and anti-inflammatories. But I think if you've got a dog that's got this lesion here, the best thing to do, because it does respond so well, is to take it to surgery as quick as we can, and they're usually galloping around 2 or 3 weeks after the surgery. However, Hach Ocd is a different kettle of fish, and we see Hach Ocd in many large breeds of dogs. It's not common in small breeds at all, but it's common in large breeds. So if we look at this radiograph and we look across the joint line, we can see the fissure here where the cartilage on the joint surface of the fibula-tarsal bone has been eroded away. Again, like shoulder OCD, there's no specific genetics involved that we can track it down. Now, I think all cases are best treated surgically to get in and remove that flap of cartilage that's in there. But unlike shoulders, the arthritis that develops after this condition can be marked, and some of those dogs are often lame for the rest of their lives. And while shoulder OCD may respond to rest and anti-inflammatories, Hach OCDs aren't going to respond. Now we'll talk about the small topic of hip dysplasia. I was thinking when I wrote that bibliography it's 1972, golly, when I graduated. But when we first moved into clinical work in 1970, they were running hip dysplasia schemes then. So this is 2019, so 49 years afterwards we're still dealing with this. So hip dysplasia is an inherited condition that affects all breeds of dogs except greyhounds and whippets and a couple of other sighthounds. And it's modified by the environment. And the environment can mean if there's been trauma or an accident to the dog during the growing periods. And it can mean if the dog's been over-exercised as a youngster in that sort of 4 to 10, 12-month period. And it can mean if it's overweight. So these factors will influence, the environment will influence the expression of hip dysplasia. But it's a genetic problem that's lying there. So the environment will only affect this genetic predisposition. So that if we took a litter of greyhound puppies and stuffed them full of food through their whole growing period, they would not get hip dysplasia. And we know this, the Penn Hip people started to do studies back in the 90s where they took litters of pups, overfed half, kept the others scrawny, and the overfed ones developed a lot more arthritic change than the scrawny pups. So if you do nothing else, keep your puppies lean. Puppies were never meant to be fat. You think about a litter in the wild. Mum goes out, kills the wildebeest, comes back, vomits it up. The puppies eat it. The puppies are dependent on mum to come back and get the food. They can certainly scrounge what's around the camp, as it were, and chew on bones and things. But puppies are not fat characters in the wild. So hip dysplasia starts off as a laxity in the hips. So the hips is a tight ball and socket joint, and for hip dysplasia to develop, we've got to have some laxity in the hips, and that extra laxity allows the hips in the socket to bounce in and out. So if we look at these two radiographs, this is a radiograph that belongs to everyone in this room. Everyone has dogs have hips like this. Beautiful tight hips. The hip joint, ball and socket joint, this ball could not be any further into the socket, nor could that one. We look along this line here where the front of the ball interacts with the front of the acetabulum, snug as snug could be. These would be 0-0 hips if we scored them. Or maybe... So when we score hips, we have to find where the centre of the femoral head is, right there. And then its relation to the dorsal acetabular edge, which means the top of the socket. That relationship allows us to score on subluxation. And some breeds, the top of the socket is small, and so you can have hips that are nice and tight like this, but you've got to score them a 1 or 2 on subluxation because of the way the rules are made. We've got no choice, and yet the hips are good. And there's probably some of you here where I've said this, gee, look, we're going to score 3 in each hip, but these are sensational hips, breed with the dog. And the other thing that I will do when I'm x-raying the hips is palpate the hips, and we can lift them out of the socket with a movement called Barden's manoeuvre, and we can do an Ortolani's manoeuvre as well, which allows us to assess the laxity of hips. When babies are born in hospital within that first week, the paediatricians come along and just go clunk, clunk, and check the laxity in the hips. So this dog here would have no laxity that's palpable. Then we move on to this pup here, and this is a young pup because I can still see the growth plates here in the femoral heads and here at the back of the ischium. So this pup is, I think from memory, was about 5 months. So while these ones are nice and tight, these ones are lax. The femoral head is barely touching the acetabulum. So you can see what I mean, that these hips could bounce in and out, and as they bounce in and out, that creates inflammation, and the dog's body then says, whoa, okay, this is sore, we've got inflammation, what are we going to do? And the joint capsule, the fibrous capsule around the hip will start to thicken because it's trying to hold the joint stable, and the bone will change and remodel too as a result of the forces that are being put on it bouncing round. So in time, what will happen with that dog is this. And this is as severe a case of hip arthritis as we'd want to see. So the femoral head has started to remodel. There's this one on the left side, it started to mushroom out. There's a little bit of extra bone growing here and here. So I'm going to go back now, if we've got that in our mind. So this set of hips here would never progress to that arthritic stage, and this set of hips here will almost certainly progress to that stage. All right, what do we know about the different breeds? So we know that the sighthounds don't get hip dysplasia. They've been selected on speed and temperament. That's particularly with greyhounds. That's the only parameter. If you're not fast and not a nice dog, if you're a greyhound, you don't get bred with. It's as simple as that. And wild dogs, similarly, they have a very low incidence of hip dysplasia, because if you're a wolf with hip dysplasia, you're not going to be able to run fast enough to get yourself a feed, and if you can't get a feed and become the boss dog of the pack, you're not going to be able to breed. So otherwise, all breeds of dogs are affected. Now the smaller dogs, the little terriers, poodles, all small dogs, hip dysplasia is nowhere near as significant in them. Lameness is uncommon. Once we started to realise that it does occur in all breeds, I would start to palpate dogs that we have in for x-rays and take x-rays of their hips just to see what's going on. So we can say categorically that within all these breeds there will be some hip dysplasia, but it's not clinically significant. It's not something that we've got to panic about. But in larger, say medium to large breed dogs, it is significant. So once we get to sort of border collie, kelpie size, it can cause lameness and stiffness. Then within the larger dogs, the tight hip dogs, the well-muscled dogs like Rotties, tend to have less arthritis develop than some of the looser hip dogs like Shepherds or Goldens. But I'm pleased to say, of late, we've had some sensational hips coming through from the Goldens, and the dogs are much better muscled. So if you can keep your dogs in really good muscle trim, then they're less likely to develop problems. And then we have the giant breeds like these things, and most of them have terrible hips. But it doesn't seem to be important. They seem to be able to get up and down and sloth around, and I suppose not much is ever asked of them. It just doesn't seem to be as much as a clinical problem as with other breeds of dogs. So we've got a dilemma, you know. Just because a dog's got bad x-rays, it doesn't mean it's going to be lame. It doesn't mean it's going to be lame. And we estimate that about 30% of the dogs that have bad hips on x-rays will be lame, and the rest are fine. And there's probably in this room maybe 10 or 12 of you could say, yeah, that's right. You know, I had a dog that was brilliant up and over the A-frames. It was brilliant doing agility, but it had bad hips. And I don't have an explanation to that. And it's something that we wrestle with, particularly as far as any elimination scheme is concerned. And if we go backwards to this bloke, to these type of dogs, I think, well, you know, how do we give advice? What do we say to these people when they've got a dog that's 12 months old and the hip scores is 15, total of 30? And they've all got bad hips, but the dog's not lame. You know, what's our advice? For me, we've got to look at how the dog moves, and then I've got to look at the dog's temperament, because I'd much rather have a dog with bad hips than a dog with a bad temperament any day. All right. So what happens? What happens? Let's go back to this one. What happens from here? Okay, if we've got that in our mind, from about 4 to 9 months is when you'll start to see clinical signs, and we'll start to, and you'll bring them in, and there'll be an abnormal hind limb gait. They may be a little bit cow-hocked, they're slow getting up and down, they're not as fast as other dogs in the litter. They're not well muscled, and as much as they'd like to be well muscled, they can't be well muscled because it hurts to move, and so they don't get their hind legs through a full range of motion, and their muscles don't develop properly. So that's what happens. Then, at about 9 months, things start to change, and these dogs aren't as lame. And what's happening is, as I described before, that the joint capsule is starting to thicken because it knows it's got a problem and it wants to hold the hips tight. And it's only the very severe cases then at that stage that will continue with their lameness. So that these young puppies here that have got lax hips, as they mature and get out to about 18 months, often become reasonably normal. I won't say absolutely normal, but they become reasonably normal. And some people will say, well, it just grew out of it. It didn't grow out. The changes in the hips are still going on, but the clinical signs have changed, and they've changed markedly. And then from 18 months on, there's usually an improvement in the gait. The dogs have learnt to cope with what they've got. The joint capsules have thickened. And the dogs know what they can and can't do. Their muscles are starting to build up, and many of them are clinically normal. And then they're going to fit into that large group of dogs that have got radiographic signs of hip dysplasia but aren't lame. So what do we do? What do we do? 5 months of age, and you've got a puppy with hips like this. Do we invest in some surgery, or do we treat them conservatively? Oops. If we do surgery, they're all going to get arthritis anyhow. If we do surgery, they're all going to get arthritis anyhow. And I've seen lots of dogs that have had triple pelvic osteotomies, and that surgery is young dogs where they fuse the pubis, and they all still get arthritis, and there's never been really good scientific follow-up from that. And one could become a little bit cynical about this. So I think, for me, I will treat them all conservatively until I'm painted into a corner where the dog's lameness is just not responding at all, and then we've got to make other plans, and that tends to mean going for a total hip replacement. And total hip replacements work wonders. When we've got an arthritic dog that we just can't control medically, they work well. And often, interestingly, we've only got to do one. We've only got to do one. and the dogs are able to support themselves so well on that leg and compensate with the other leg that they don't have to have the second one done. And this was an interesting dog. This pup, he was a very, very active agility dog, really good dog, and he had arthritis in one hip. So if we go back to where we started and we were talking about the environment, something happened with this dog, because he can't have one horribly arthritic hip and one normal hip like that. That's not going to work. The laxity is going to occur. If we've got laxity in the hips, it's going to occur in both hips. We never worked it out, but there must have been, during that sort of 5 to 9 month period, there must have been some trauma that happened to cause arthritis in that hip. And there is, as some of you may be aware, also a condition called Legg-Perthes disease, which tends to occur more in poodles and smaller dogs, where they fracture during, as puppies, they fracture across the femoral neck, and as that heals, that joint will become arthritic as well. But again, in most small dogs, it's not significant. And this pup, Sam Snelling put that in for us, and away went this dog. It was a great success. So there's a real place for total hip replacement in the treatment of hip arthritis. But I think we need to exhaust our medical options first of all. The fun joint, elbow dysplasia. Elbows don't respond well to arthritic treatment. They're a real nightmare. So elbow dysplasia may consist of one of four things. It may consist of OCD, it may consist of an ununited anchor-nail process, which is this fracture line through here. It may consist of a coronoid process where the articular surface of the ulna fractures, or it just may simply be elbow incongruity, where the joint lines here don't quite marry up. OCD is a little bit of ulceration that occurs in the joint, and it is really common in a lot of large breed dogs, and they will be... I thought that was Peter for a moment, Dawn. It's common in large breed dogs, and you'll see a bit of lameness. So people will bring in a 6-month-old, particularly shepherds. I probably see this more in shepherds than any other breed, and it's a little bit lame. And you feel those elbows and the lame leg. It's got a little bit of muscle withering because it's not using the leg all that well, and there's a little bit of swelling in the elbow joint, but range of movement's good. There's no great pain when we flex or extend the joint. And often all we have to do with these is say, right, control the exercise, get the weight off, put it on a course of Pentazan, and wait, and we'll see what happens. And the vast majority of those where they've just had a little bit of ulceration of the joint cartilage, and it's most likely started off with trauma as they've jumped down or been too active in some exercise. Most of those get better. But we will see some changes when we do their screening radiographs after they're 12 months old. Okay. So the compounding issues then of elbow dysplasia are the same as for any joint. Weight, over-exercise, this little fella here doing his sit-ups, love that, isn't that cute? Over-exercise and trauma. What are the genetics? It's not clearly defined. We're on our own, and we've been on our own for a long time. Now, most of the elimination schemes say don't breed with a dog that's got a score higher than grade 2. All dogs with elbow dysplasia will show some arthritic changes. And as I said before, elbow arthritis is usually associated with lameness. So let's look at some radiographs. How do we score them? How do we score them? We fold the leg up and fire an X-ray, what we call a lateral X-ray, side on through the joint. So if we look at this joint, this piece of bone is the anchineal process, and here is a tiny spur of bone, extra bony growth. Here, right? And we measure that. And depending on how big that is, that's how we grade the elbows. So if that is less than 2 millimetres, you're a grade 1. If that is between 2 and 5 millimetres, like this one here, that's a grade 2, and if it's greater than 5 millimetres, that's a grade 3. And most of the schemes say don't breed with grade 2 or higher. But these ones, these ones here, this is what we'll commonly see. And I'll say to owners, well, you know, has Rover ever been lame? No. Never had a problem? No. Nothing's ever happened, and yet that sits there. And I don't think it's of any significance to that dog, and it's certainly no reason to throw that dog out of the breeding pool.
How old was that dog at the time of that radiograph?
Say again?
How old would that dog have been at the time of that radiograph?
Oh, that dog could have been 12 months. Yeah. And that'll stay like that for the rest of that dog's life. That won't progress. Yeah. Whereas the dogs that have the ununited anchineal process, they're a different kettle of fish. So how do we treat it? Dogs that have a fractured coronoid process, where the tip of the coronoid process off the ulna comes off, they're best treated with surgery. Okay. These dogs are lame because they've got a tiny little chip of bone in their joint and it's like a stone in your shoe, and they're lame and it hurts, and it's best to get that out as quickly as we can. And the surgery is not all that difficult. You know. Now, even though we do that, after that surgery, we've been in a joint, we've created some inflammation, there's going to be some arthritic change. So no matter what we do, that arthritis is still going to appear, and it's stubborn to treat when it becomes clinical. That's elbows. Oh, I should, if we want to talk about the ununited anchineal processes, some surgeons will screw them back on, some will remove them, others will just say just leave them and let's see what's happened with weight and exercise control. There's no hard or fast rules as to how you treat them. Well, it's best assessed on an individual case, because and we can see some dogs that have got ununited anchineal processes and no lameness. All right, so cruciate ligament disease. It's common in all breeds of dogs except greyhounds. Very rare to see a greyhound pop its anterior cruciate disease. We have this saying amongst vets that all dogs with a hind limb lameness have a cruciate injury until you prove otherwise, and I think it's a good thing to assume. And they stand like this. You know, they've got a sore joint and they're up on 3 legs. Okay, and because there's injury within the joint, there will always be arthritis. Small dogs, sometimes we can treat them conservatively with anti-inflammatory drugs, etc., and they'll cope very, very well. But most dogs need surgery to stabilise the joint, to stop. Once the cruciate ligament is ruptured, the joint can slide back and forward on itself like that. And that movement, similar to the movement in the hips where it bounces in and out, that movement predisposes to the arthritis. So if you've got a dog, you know, it's just bad luck and you're really stuck with surgery. Back degeneration, All breeds of dogs, congenital in some breeds, the little Frenchies we can see it, and other breeds. Talking to Robin before, the Frenchies still have their schemes. Is there any other breeds that have schemes for spinal abnormalities? No. We'll commonly see in shepherds a transitional vertebra where the L7 and the sacrum don't know which is which. All breeds, as I said, are prone to develop this spondylosis where we get bony spurs growing underneath the spine. I've got no clues as to the heritability of this. I want to talk for a moment about trigger points, myofascial pain. And trigger points are where we've got muscle spasm from repetitive injuries, and they will cause dogs to be lame. They're common in weekend warriors, and it seems to be this breed too. They're common in dogs that go out. That dog would go out for the quail season. Okay, so it might go out for 3 or 4 or 5 weekends in a row and come back lame. Trigger points are also very, very common to occur after any joint injury where we've got joint pain. Now, a classic trigger point lameness is one that does not respond to medication. It doesn't respond to medication, but it does respond to rest. So that's what happens with these characters. They go out, they exercise like crazy, and the muscle goes into spasm. Oh, that hurts and I'm lame, but if I rest, it'll go away. And you've all got trigger points. If we were to walk around and massage each of your shoulders and your neck there'll be those tense areas that you've got there from sitting awkwardly or what have you. We've all got trigger points. How do we treat them? We can use heat packs, we can massage them out, we can use laser. Laser works really, really well. We can use dry needling and acupuncture, and at the end of it all, we've got to do stretching, because when the muscle's gone into spasm, it's shortened, and if we relieve the spasm, then we've got to stretch it out afterwards. Now, another simple way to explain this to you is if you go and have a massage, particularly up and down your spine or around your neck, and the massage therapist will find a trigger point and they'll press on it and it hurts, and then what they do is they lean on it and they press on it and it hurts more, and then it melts, and what's happened is we've squeezed all the blood out of it, there's no more oxygen, the muscle's just got nothing left and it's got to relax. Okay, and trigger point's gone. They'll commonly reform. So we've got to stretch them out afterwards. Now, we can't tell a dog just to lie still, Rover, this is going to hurt for about 10 seconds and then you're going to feel better. That doesn't work. And that's why things like massage and laser and even dry needling are good for it. But just keep that in mind. A lameness that doesn't seem to respond to anything and does get better with rest. How do we prevent arthritis in young dogs? I'm talking very young dogs here. Weight and exercise control. Don't let your puppies gallop around excessively, particularly if they're overweight. The foods that we have, the commercial dry foods that we have now, are so energy dense. It is really easy to produce tubby puppies, so just be cautious of that. We also need to watch the calcium and phosphorus levels in the diet, and we have to have a calcium and phosphorus ratio in this order of 1.2 to 1.4 to 1. So that's the calcium and the 1's the phosphorus. The main source of phosphorus in a dog's diet is from meat. Dogs also need vitamin D, which they will get from the diet or they will get from the sun. Get your puppies outside. They need vitamin D to absorb and utilise the calcium and phosphorus into their bones. The dog foods will all have how much calcium and how much phosphorus is in them written on the bag. They all have it there. We just have to allow for the meat. We can also give puppies fish oil, omega-3, the EPA, or eicosapentaenoic acid. EPA helps stop cartilage degeneration, and that only happens in dogs. Okay, if we take fish oil, if we take the EPA in the fish oil, it just functions as an anti-inflammatory. It doesn't affect the joints specifically, but in dogs, and I think mice are the other mammal that it does this in. There's only 2 species that it works that way. Now, so the commercial foods will have calcium and phosphorus in the right level, believe me. But if we're feeding meat, then we've got to add calcium. Now, there are a multitude of supplements on the market, and I'm not going to have a discussion about that here tonight because you'll all have your favourites. To me, I like Hach Ocd. I like the product Hach Ocd because it clearly states on there, and I've had this discussion with the company that makes it, it clearly states how much supplement you give per 100 grams of meat. And that's a very simple way to cover your butt and make sure that we get calcium and phosphorus in the right ratio. So it's simple. Balance your calcium, phosphorus, don't get them too fat, don't over-exercise them. Older dogs, again, weight, exercise control critical. We do need to watch the calcium and phosphorus levels in them. So again, if you're feeding a lot of meat, I would supplement with some calcium. You can't over-supplement with calcium, but there's no benefit in giving teaspoon after teaspoon after teaspoon of calcium per feed. Get them out in the sun so they get some vitamin D. EPA is good. The other nutraceutical I like is Foresight. We'll talk a little bit about that later. So that's the older dogs. Let's get on and treat arthritis. Now in us, arthritis is treated much earlier because we will feel, God, you know, that knee is sore, I want to do something about it. And we've got good access to CTs and MRIs, whereas a CT or an MRI on a dog's $600 or $700 at a minimum. And we really don't pick up that our dogs, for most people, you don't pick up that your dog's got a problem until they're becoming significantly stiff or lame. And so, because we diagnose this later on in life, the changes that we see on the radiographs are often quite marked. When I was first starting off with stem cells, I was invited to speak to a human conference on putting stem cells into dogs' joints, and I put up some dog x-rays, and they couldn't believe them. They couldn't believe how horrific the arthritis was. Now, fact, most cases of lameness and stiffness involve more than one joint. Okay, it is very rare to find unilateral arthritis. It may be in a case where we've had a cruciate injury. It may be where we've had a fractured ununited coronoid process or a fractured coronoid process in one elbow only. But single joint arthritis is not common. Okay. And then we've usually got degenerative lesions of the spine as well, which I talked about before. I'll say to my young vets, you've got to x-ray the back as well. You've got to know, you've got to understand everything that's going on with this dog. Don't just treat the leg that's apparently sore. The use of cortisone. Cortisone is the most wonderful anti-inflammatory drug, and it's very, very effective to inject it into a joint when you have got single joint arthritis, okay, where you have got a dog that's a little bit lame after cruciate surgery or after elbow surgery. Popping cortisone into the joint is really effective. And oral or injected cortisone is very useful in controlling back pain. I think crookbacks do better with cortisone than they do with other anti-inflammatories. And the other anti-inflammatories we lump under this group of non-steroidal anti-inflammatory drugs, and these are things like Rimadyl and Meloxicam or Metacam. There's a number of them on the veterinary market. Now, they're very efficient at controlling joint pain. They're pretty good at controlling spinal pain. I don't think they're as good as cortisone.
Sorry, what did you say the top one was?
Rimadyl. Rimadyl, Carprofen.
Thank you.
The schoolboy error with the use of non-steroidal anti-inflammatories for arthritis is you've got to go for a long time with treating them. You just can't give a dog with elbow arthritis a 1 or 2 week course of anti-inflammatories and assume it's going to get better, because the underlying pathology is still there. We've got to treat on and on and on. And often, as some of you will know, I'll get you down to every second day or every third day or twice a week, but you've got to keep that anti-inflammatory punch going. You know, in this room, I'll bet half of you have got arthritis, and if any of you are taking medication, you know you've got to keep at it. You've got to keep at it. It's not a 1 week treatment. Arthritis doesn't go away. You know, we never cure arthritis. We only ever control it. And if your dog's on Rimadyl and it's not doing real well, then you may need to change to another one. Different anti-inflammatories can react differently with different dogs, different people. And you know, the side effects of this, and we've got to be careful with all of this stuff, is it can cause vomiting and diarrhoea, it can cause ulceration of the tummy. So we've got to make sure that it's given with food. Now then, there's a whole host of other things that we can use. And my staple is the non-steroidals and cortisone, but we can also use tramadol, which has a very varying response in dogs and often makes them sleepy, and I don't like it. Paracetamol seems to have become a flavour of the month at the moment. It gives me a variable response. So I can see no benefit to using, no real benefit to using that over the other non-steroidals, and it's fatal in cats. Yeah. Don't give your cats paracetamol.
Dogs have a reaction to tramadol when you take them off, like people do?
No, I don't think so. In fact, usually the best reaction they have when you take them off is they feel better because they're not dopey from it.
So they don't have any depression.
I don't know. The universities teach the students that this stuff is bad and that cortisone is even worse, and yet we've used it for years and years, and they have all these new, well, I won't say newfangled things, but things that are more difficult for us to assess. And so we have gabapentin and amantadine, which are best used together, and they are more specific at controlling nerve pain. There's other stuff that Nicole that I work with, some of you know, lovely girl, she's a bit keen about this stuff called P, which works on the cannabis receptors. So there's a lot of things out there, but I think, you know, general advice, stick with what we know works, and then when that's not working, then we can move outside. I will talk about pentazan. It's the most wonderful medication for arthritis. Pentazan, Carprofen, Zydac, all the same stuff. Again, we've got to use it on a long-term basis. Once you've had your first 4 injections, keep going with it. So usually the usual protocol is to have it monthly after that, and then as we get the joints under control, stretch it out. So I'll have some people will come in 3 monthly, some 6 monthly. And you can get it out to 6 monthly, and it still gives that booster effect. So it's great stuff, and it doesn't have any side effects. I don't know of any dog that's ever had a problem using that. The stem cells, there are two sorts. The allogeneic, which I use, which means we've got the cells from another dog. They go off to Monash Uni and they culture them there in their stem cell lab. Or there's the autologous stuff where you go in, your dog has some surgery to remove a bit of fat, and the cells are processed from that. I prefer this way, obviously, because that's what I use, rather than autologous, because it means two procedures. Stem cells are most useful in single joint arthritis, like cortisone. There are some veterinarians, including me, who use it intravenously when there's a lot of joints involved, but I don't use it that way all that often because I don't necessarily get the response, the wow response that I'm after. How do stem cells work? They have an anti-inflammatory effect, and they seem to tell the tissues around the joint to start regrowing. So they stimulate regenerative factors. And stem cells are also very, very good in tendon injuries. This is important for dobies and greyhounds, which will do a lot of tendon injuries. Dobies, as some of you may know, are prone to injure their gastroc, their calf tendon. So here's a normal leg, and here's the affected leg. You see that massive swelling there, and this dog can't hold his toes normally. Okay, so there's the normal leg, and there's the affected leg. They can be a bit tricky to treat too if they really tear them. Natural therapies, fish oil, love it. The omega-3s certainly have an anti-inflammatory effect and block aggrecanase, degeneration of cartilages. Epitalis, which is in Foresight, Melbourne Uni, did a good study that showed that it was fairly effective compared to other anti-inflammatories, and that the epitalis will stimulate cartilage cells to grow. Glucosamine and chondroitin. I like glucosamine we get from shellfish and from plant extracts. The glucosamine provides building blocks for joint cartilage, and chondroitin, the use of the fish or cattle cartilage, helps reduce cartilage breakdown and reduces inflammation. Now, whether you've got 2 legs or 4 legs, the studies are variable. The studies are variable, and there are papers that will say in people it does nothing. There are other studies that will say in people it does something. I find that it helps some dogs, and I can't be specific as to which one, but there's nothing wrong with supplementing your dog that has arthritis with glucosamine and chondroitin. The abalone, which is in Foresight, also has high levels of glucosamine, and it helps prevent dilation of the blood vessels in the joint. The New Zealand greenlet mussel, which is you can buy singly, or it's also in Foresight. You get a good bang for your buck here, I think. It's got a whole heap of these glycosaminoglycans, glucosamine, chondroitin, and the omega-3s, and it also has ETA, which is a isotetranoic acid, and that reduces inflammation in the same way that Rimadyl and meloxicam do. So there's and that's the product there. I think this is a useful product, and there are other things out there that we can use. Turmeric, which I know some of you are keen about. The active ingredient is curcumin. Now, it also works the same way as Rimadyl and Metacam, in that it's a COX or a cyclooxygenase inhibitor. So that's how it works. And it's interesting with all these natural products, which I'm very supportive of, very receptive to. When you drill down on them, there's a reason why they work, and most of them come back to functioning just the same as our more conventional medications do. But if you've got your dog on curcumin and it's working, well, that's great. As a veterinarian, I can only say that, but it would be inappropriate of me to prescribe that as your first line treatment. Okay, that's the dilemma I'm in. Just hang on, we'll do questions at the end if we can, please. And then turmeric. Who uses golden paste? We've got one, two, only one, two. Yeah, here we go. So, and you make your own up? Yeah. Okay, so this is a turmeric mixture. Now, I just pinched this recipe off the web, I think, or I don't know whether Nicole sent it to me, but I would look at this and say 1/3 of a cup of coconut oil or linseed or olive oil, linseed meal, linseed or flaxseed oil every time. It's very rich in omega-3s. I can't think why they would put coconut oil there. Maybe it's because it tastes right, but that's a medium chain fatty acid. Sorry?
You need the oils and the pepper together, so it'll extract the curcumin from the
Yeah. Well, I'm just saying, if I've got my choice of these 3 oils, pick linseed every time, pick flaxseed. Boswellia, it reduces inflammation as well. Cannabis, we're starting to hear a little bit more about. It's expensive, but it's like some of those other drugs, the amantadine and gabapentin, that reduce the inflammation of nervous tissues. Physiotherapy.
Slide, I'd like to. There's something there about the THC. Could I?
Yeah. Well, I'll show you afterwards. We'll keep rolling on.
Oh, it's been removed. Okay, thanks.
I think this is, over the last few years, this has become a really important part of how we treat dogs that have had joint surgery, how we treat dogs with arthritis, and just simply moving a joint through a range of motion. Remember what I said before about that joint cartilage needing to be compressed and allowed to expand. And how do you mobilise a joint? You just take it to the point where it can't move any further and just push it a little bit further. Don't hurt your dog. We're not in the pain business. How often should you do mobilisation? Once a day, 3 times a day is fine. Do about 5 reps at a session. You've got to have a dog that's amenable to this. It's not for every dog, and it can be very difficult in some dogs. So things like, here you go, Dawn, I'll make you famous. Things like, simple extension of the elbow, flexion of the elbow, getting those joints through a good range of motion. And mobilisation we can also do just with simple exercise, with swimming and walking, and underwater treadmills are really, really useful. And there seems to be more and more of them popping up. I'd love to have one at Monash, but I can't get Stuart to buy one for me. Strengthening exercises. When you've got an injured joint, the muscles around the joint will go into protective spasm. So if you all imagine that you've got a really, really sore elbow and you're holding it like that, and I'm going to come to you and I'm going to move that joint, and what are you going to do? Reflexly, you won't let that move. Okay? If you've got a crook back and you're standing there and someone comes to a close, you think, God, say, don't hit me, and you tense up. So we go into this muscle spasm. Arthrogenic inhibition, it's called. And to get rid of that spasm, we've got to control the pain in the joint. So our first move, our first step with arthritis is to get rid of the pain, increase the range of motion, and then we can go ahead and start strengthening. But you can't strengthen muscles that are in spasm, that are protecting the joint, are very difficult to strengthen because they won't move through a full range of motion. So there's some really important and simple concepts. Use your medication, your pentazan and your non-steroidals to get rid of the pain, increase the range of motion, and then start strengthening. Now, when we strengthen a muscle, it's best to move it through a full range of motion as well. If I do exercise like this with the dumbbell, I'll build the biceps up a little bit, but I won't build them up anywhere near as much as if I take that muscle through a full range of motion. And you can make up strengthening exercises, just walking up slopes, the underwater treadmill, swimming is good. Balancing on three legs. If we've got an affected front leg, if you pick the other front leg up so that the dog's just balancing on hind legs and one leg, that will get it to use muscles that it's not using. You can get it to balance on unstable surfaces. There's a whole host of things, and if you Google this type of thing on the net, there's a squillion things that we can do. I think also to help our sore muscles and joints, heat is good. Infrared lamps are really, really good, but just simple heat packs. Your lavender packs, shove them in the microwave. It will help reduce muscle spasm, where you've got muscle spasm around that sore joint, and it's really good to use before massage because it helps relax the muscles. And it's really good to use when we've got stiff backs. Heat packs, most dogs love to have heat packs put on their backs, and then you can go ahead with some massage if you like. If you're going to massage again, I don't think there's too many great tricks about massage. You can massage around the joint and massage the affected muscles. So, how do you massage a muscle? The ones over the shoulder, we can only massage wax on, wax off, because they're flat muscles, whereas the thighs, we can do a kneading massage. Just gently, what are we doing? We're helping the muscle relax, we're helping stimulate circulation, particularly after we've had a heat pack on there, which is bringing in more blood, more goodies, helping heal the affected tissues. Cold packs are only useful where we've got acute injuries, which, sudden onset, I sprained my wrist going over the A-frame, or where you've got an arthritic joint, like you think you've got a whole sprained ankle and you do it again, you think, oh God, that hurts, That has become an acute injury on top of a chronic injury. Ice packs for a couple of days will be good. Ultrasound and magnetic field, I don't think many of you guys have that, but they're useful techniques. A lot of greyhound trainers have this type of things available for them. Laser, we now in the veterinary profession have these flash class 3B and class 4 lasers, and they are wonderful. They are wonderful in helping control a lot of musculoskeletal problems. What does laser do? It's anti-inflammatory, it reduces pain, it stimulates energy. There's reams and reams of positive effects from using laser. Also, the treatment times, particularly when we're using these class 4 lasers, is really, really short. And most dogs that we treat are in and out, within 2 or 3 minutes. And if we're using it, say, particularly for trigger points that we would have had to have popped a needle into previously, we don't have to. There's no pain. And so the dogs are pretty happy to stand there, have the laser on and just chew treats. And there's a multitude of settings these things will treat. Back pain is the main one. It's really, really good for dermatitis. Lick granulomas. Anyone had experience with lick granulomas where dogs chew? The first couple I had, I said to people, they reckon this works, so I will treat your puppy for nothing, and they got better very, very quickly. I was quite amazed. So that's wonderful. Exercise control, just avoid excessive exercise. Now, this point about how much exercise. If we walk a dog with an arthritic problem or a back problem for too long, then the muscles that are holding the joints or the back so that they don't get hurt become tired. They become tired, and the dog will develop some lameness because it can no longer hold it. It can't protect the back, or it can't protect the joint. So I reckon anything more than 30 minutes on the lead is just too long. And 2 by 20 minutes is much better to exercise your dogs, or 3 by 20 minutes. But don't go for a long time, because you will fatigue those muscles and they can't hold the affected joints as rigidly as they'd like to. Righto, how'd we go? It's pretty good. Fire away. You've been itching to have it.
I just need to explain to you the system, because we have our live streaming members coming through the system. We need to talk into this microphone so that it picks up on the live streaming, so that everybody can hear what's going on. So you can choose your question and I'll run around.
So,
Okay.
So if you give Foresight and you give chondroitin and glucosamine, are you double dipping?
Yes.
Too much?
Yes. Yes. You would only need to use one of those. So the question, could everyone hear that? No, okay. If you're using glucosamine and chondroitin and you thought, oh, I'll give Foresight a go, are you double dipping? Yes. Yes, yeah, because Foresight's got a whack of glucosamine and chondroitin in it. Good question.
Second thing, stem cell therapy in New South Wales, apparently it went out of flavour. It sounds as though you're still using it here and you still recommend it. I'm talking about from the same dog.
Oh, autologous stem cells,
autologous.
Yes. I can see no reason to put a dog through 2 procedures, so that's why I would just use the stem cells that have already been cultured. They just sit in my liquid nitrogen tank, okay? The stem cell therapy, when we first started, I thought it was going to be the fountain of youth. Yeah. It's not, it didn't become the fountain of youth that I hoped it would be. And part of the problem is because we've got multiple joints. We're usually treating multiple joints. And so it becomes easier to rely back on systemic treatment, starting with Pentazan and the non-steroidals, Rimadyl and Cartrophin. Okay, good question again.
Got to keep it about 2 inches from your mouth.
Yeah, I just got a question about is sardines with oil in a dog's diet good or bad?
Good.
Good.
Is sardines good or bad? Yeah,
Sardines,
no, it's good.
oil.
It's good protein. It's a vegetable oil usually, and there'll be some omega-3s.
And you give it to puppies as well as dogs all their lives, no problem?
No problems.
Even once a day?
Once a day is fine.
Every fine, yeah.
Yeah.
Thank you.
We'll pass it along.
Hi. When you were talking about hip dysplasia, you mentioned you look at the structure of the dog, the back, and if they've got cow hocks. So is there a correlation to a dog with cow hocks? Are they more likely to have hip dysplasia?
Don't know.
Don't know.
Don't know. We don't know if there's a correlation. No.
Okay.
No.
My next question is, you're saying puppies grow lean, to grow up lean, not to be overweight. Does this relate to puppies when they're being weaned as well, like from when they're 4 weeks to 8 weeks, or is it 4 weeks to 8 months? What do you class as puppies being?
I think it's from 6 weeks on. Just got to remember, in the wild, in a natural population, they're not getting 2 cups of Royal Canin a day, plus milk.
Can Foresight be used with a dog that's on like Vetmed, Cardishaw?
Yes.
Yes?
Yes, I know of no reason why not. No, there's no interreaction there. Mm-hmm.
And in which case then can, the other ones like Tramadol and things like that also be used with Vetmed?
I would be cautious when we start moving into those medications that are the morphine type ones, like Tramadol. Okay. I think it would be essentially it's probably all right, but I would want to do some cross-referencing before I would change, and I would say, well, why do you want to put your dog on Tramadol anyhow?
Oh, it was just one of the different options.
Yes, yeah.
There.
Yeah.
Is the pectineal muscle still removed in puppies or not done anymore? That's gone out of fashion, has it?
Mm-hmm. Yeah. So in the old days, we used to remove the pectineus, and it's a little muscle on the inside of the leg, and sometimes you'd have to go and remove it a second time so that it was completely gone. And usually by the time you'd done the second surgery, they were starting to get better. Okay. What was happening was underneath all of that, the joint capsule's thickening up, all that remodelling is going on. The dog's now about 9 months, and it's going through that normal progression that I put up there. Yeah, no, not done anymore. But that's a good question.
Sophia, do we have some questions? No questions online?
Very happy with it.
We're getting positive feedback. Thanks, everybody.
Can I just have... yes, Ray, are there any notes available for tonight's talk?
Are there any notes?
Yeah, I think... yeah.
Oh, I could...
We did have printed notes at the other seminars. Is it possible to get these notes?
Oh, yes. Well, I can send you this as a PDF.
If that goes to Anna at the office, that would be great.
Yeah.
And then
would you all be happy with that if I just give you a copy of those slides? Yeah.
Yes.
Yeah. Okay.
I say we will put that on the website and make that available soon.
Yes. Yeah. Okay. Okay. That's easy. All right.
Can I have a question?
Of course you
You were talking about the elbow issues, and at one stage you were talking about the grain of sand effect.
Mm-hmm.
Is that going to be something that's come as a result of trauma?
No, it's usually as a result of elbow incongruity, where the joint surface of the ulna and the radius aren't quite in line, and the ulna's up a little bit higher, it takes the weight and then it fractures off there.
Okay. And can you just tell me something about radial head luxation?
Not a lot. I can tell you, that's a rare problem. No, I can tell you. Radial head luxation usually occurs if there's been injury just above the wrist to the growth plates.
You
there.
just said the word I wanted to hear, injury.
Yeah.
Yes. Because my observation and my concern is that general puppy owners are not able to analyse, is probably the wrong word. They don't know how to look at their dogs moving, and so they're not aware that their dogs are carrying injuries. And in fact, because I live out of town, I don't drive around metropolitan area, but the other day I was around on a Sunday morning and watching everybody running there, jogging along with their dogs, and I tell you what, I think there's a lot of dogs that would go home and sleep probably from pain as I looked at the way they moved, as they... Yeah, so generally people just aren't aware that these dogs...
Yes.
I'll go there. Sorry. No. We'll get back.
I'm just wondering, do you think that sometimes we miss spinal or back injuries because where we see the clinical symptoms are in the limbs of the dog?
Yes. So the question is, do we miss back problems when we're focused on a joint? And they're going on concurrently, because if we take a dog with a cruciate injury, it's on 3 legs, and so the normal angulation of the spine isn't right, and then it'll go into some spasm. This brings me to another point. Okay. I used to do a lot of chiropractic work on backs. I used to straighten a lot of backs up. And then I learned about trigger points. And then I learned, and muscle spasm. And if you can relieve the muscle spasm, then the spine will largely self-correct. Okay? And the Bowen therapists, their basic theory is if we can just get one joint to straighten up, then all the rest goes clatter, clatter, clatter. And for those of you that go to chiropractors, more and more, and I go very occasionally, but I notice now that they're in there relieving the trigger points before they do their adjustments. And I'm starting to think, well, why don't we just relieve the trigger points? So I think heat packs and massage and trigger point therapy is a much better way to go. And it's certainly more comfortable from the dog. And if you think about that spine that I put up there with multiple spondylitic bridges there, try to do some adjustment on that. What the hell are you going to do? You know, all that bone is holding the spine rigid. We can't mobilise that. You know, the best we can do is relieve the muscle spasm and relieve the pain that way. So are we clear on that? What do acupuncturists do when they're treating spinal problems? They go along and they're popping their needles into the active trigger points along the spine. Down the spine is a very classic acupuncture meridian called the bladder meridian. And if an acupuncturist, someone who's really skilled in acupuncture, comes along and watches what I do, whether it be with the laser or with the needle, they'll say, but you're just putting that down the bladder meridian. I said, yeah, I understand that. You know, we're getting this to the same point, just with different thought processes as to what we're doing.
Is most arthritis in older life, does it come through because they had problems as a puppy?
Yep.
Or can it come through from an older injury? Or if your dog's not injured till it's 6?
Oh, it can still develop arthritis from that, yes. Think cruciate, yes. If you have a cruciate injury, yes, or a car accident.
Yeah, so Ray, you're saying that if you can relax the muscles,
yes,
well, then you're sort of halfway there.
Yes.
Is it something that we as owners can do, or does it require somebody who's technically experienced? I mean, is it something that you can just really work out yourself?
We can all put heat packs on, and we can all do massage. We can all do that.
Because I was actually corresponding with somebody in Western Australia, and she is a chiropractor, and she's saying that more and more she works with the myotherapist first, and then she does the manipulation, because they're getting stable results. Otherwise, they tend to not be getting that. It's not holding. The pattern's not holding. Okay. So what Wendy's saying is, yes, that we do the massage, then we do the chiropractic work, and it may not stay sound. Then I would be then we need to look back for the underlying pathology. Now, if it's got some bridging spondylosis, which is hurting the dog when it jumps up and extends its back, then everything's going to go back into spasm again. So you just go back to square one. So same as I was saying with all joint conditions, if you're going to use non-steroidal anti-inflammatories, you've got to keep at it, because the underlying problem's not going away. Now, classic back injury is the dog jumping out of the car, or jumping down from your car, and it yelps, and up comes a leg. Okay, well, what's happened there? He's leapt down, he's overextended his back, he's put pressure on the sciatic nerve, and the pain's gone down the leg, so I'm going to hold it up. Okay, so who here has had a back problem with pain going down the leg? Look at us all. So you all understand exactly what's going on. And does it hurt? Yes. Yeah, it hurts. And so when dogs yelp, that's sharp pain. That's acute, sharp pain. An old dog with the crook back doesn't yelp. They just don't move. They just don't move. But acute pain, they yelp. And the history of, if you come in with a dog with a problem and you say, oh, he yelped, that's a real red flag for finding out where that acute problem was, whether it was in the spine, and it usually is in the spine, rather than a peripheral joint. Yeah, good point.
You were talking earlier during your talk if you do, for example, a hip replacement.
Yes.
So the laxity would be on potentially both sides of the hips for the dog,
Yes.
bilaterally. Hip replacement, so it's got one good leg, compensates. In that case, though, you need to be aware, don't you, of how it's compensating. So if you're increasing things like range of movement and strength, for example, in the leg that's good, you would equally need to make sure the front that also works with that hind, etc., is also got good range of movement and getting strengthening.
Yes.
Just because otherwise you'll get injury, yeah?
Yes, yes. So that, Sharon, most people, most surgeons that do this work have got physios working with them, and they want people to come back, just the same as happens to us, and work on that joint, work on strengthening the joint where the surgery's been, and looking for other problems where the dog's compensating, the front legs, or the maybe the contralateral, the other unaffected leg. Yeah.
How do you know if a dog has pain, or if it has pain, it might not show it? I mean, is that like, I've got a very active dog who's got a bit of age. She doesn't show any problem with anything, but how do I know if there's pain or not?
Oh,
or is it
that's really difficult. But the simple answer is change in behaviour.
There's no change.
They're not as active. They're not as bright. They just don't do things that they used to do.
Normally everything's fine then. No
Yep.
arthritis, no
Yeah.
nothing.
Yep.
Can I just ask? I don't know whether I should ask.
When I was first using stem cells, and the first 5 cases I picked were all one joint. These dogs just had bad knees, and we put the stem cells in, and they all got better. And wow, it was exciting. But one thing that those people said, and people where we still use stem cells now, say the dog's happier. The dog's happier. That's a change. That's what you guys as owners will notice. If we're on the wrong track, on the right track with our therapy, the dog's brighter. All of a sudden Rover's jumping up again. And cats are amazing. Older cats have pretty horrific arthritis, and it's often never ever diagnosed, and we'll feel it in a consultation and say, look, I think Fluffy's got a bit of arthritis, can I just give some cortisone? And they'll ring up and say, he's back jumping on the table again. I didn't realise.
See, our cat's 20 years old, but we don't know if there's anything wrong with her.
So the fair bet there'll be something wrong there somewhere. we'll find something.
You mentioned for hip dysplasia that your last resort would be a hip replacement or surgery. But however, I'm seeing, and a number of my fellow breeders are seeing, that our puppy owners are going to vets for their first vaccination, and there's certain vets that are saying, oh, you've got a breed that's prone to hip dysplasia, you need to get hip replacement surgery. Why are vets now more commonly telling our puppy owners that their dogs need hip replacement at 12 weeks?
No, I think it'll be the pubic fusion.
Okay.
I think that's the procedure.
What breed?
All breeds.
Really?
All breeds, and that's what I'm trying to explain to this group is there's a natural progression of what's going to happen whether you do that surgery or not, and I would step right back. We do not do that surgery at Monash, okay? Yeah. But some hip dysplasia is incredibly complex. Understanding the whole pathogenesis of it, how it works, what's going to happen. So you're getting a few years of dealing with it here. So I would prefer not to do that surgery. Yeah. Some people will do that pen hip examination, and pen hip is a really good guide to whether your dog's going to go on and get arthritis. It's not necessarily as accurate as we hoped it would be for breeding potential, but it certainly gives us a guide. But if we do that laxity examination, that pen hip examination, or even just ortolanis in young puppies and say, wow, you've got lax hips, you've got to have this surgery done, I would say, well, let's just pause. Let's give it some Penazan. Let's give it some Cartrophin for 4 weeks and see what we've got. And I would say that almost invariably those puppies will have improved and there's no need for surgery. Are we done?
I think we're done. One little sprint to the back.
In a puppy with hip dysplasia, how early would you start Cartrophin?
When it was lame.
Okay, thank you.
When it was showing clinical signs, simple as that. Yeah. And you would have already been keeping it lean and giving it fish oil and... Yeah.
Thank you so much, Ray, for your wonderful information this evening. I really did like your human parallels, a great way of communicating, and I can tell you that when the hip dysplasia gets resolved, as in 2 new hips, the energy level certainly increases enormously. And partly to answer one of those ageing questions, the problem is that the discomfort grows on you slowly and you don't actually realise what's happening, so we really need to be looking at our dogs. But great to know that there's good places to go to get information. So it's been really informative for me, and I'm sure everybody else. A little token of our appreciation.
Thank you.
Thank you.
A lot of fun. Thank you very much.
Thank you.